So this is the other story she tells me. She tells me they did liposuction on a lady, right? And then she was during the process of healing, right?
Yeah.
But she's in a open relationship with her husband. So she's got a young Ben 10. Wow. And then when you do that procedure, you're supposed to heal for like, I don't know, a month or two, right? And then the Ben 10 couldn't wait anymore. Wow. So after like 2 weeks, he went in. He went in, bruh. And then when she went to go see the doctor to consult, they told her that she has to go back and do the operation because he ripped her up.
Oh, R.I.P. to her.
Wait, which procedure? Lipo?
Yeah.
What does it have to do with the vagina?
No, it's not the vagina. I get it like, the vagina is connected to this part of the body.
Okay.
And then that's where the healing needs to happen.
So over rough,
Yes, they was going into
Who touch it from the
inside. And Ben 10s, they got energy.
Passages of the vagina.
So such things do happen, friends. It's not a joke, it's real. Ripped stomach after liposuction. Are you thinking of going for a liposuction or your tummy tuck? Here's the information that you need to know before you fall prey to such mistakes. You might be wondering, what does it involve? Is it painful to go for a liposuction, your tummy tuck? And that $1 million question that Mac just raised, how long do you have to wait before you go back to your bedroom? So this video is going to cover that, and you obviously look at the difference between a tummy tuck and liposuction. What is the difference between the two? Which one actually gets you back to bed in the quickest time possible? Stay tuned, guys. Let's get into that. And by the way, before you rush into making an appointment, I just want to be clear to you, I'm not your plastic surgeon, I'm not your doctor. I'm just here to give you that information that you need. That information that maybe your friend out there might need as well. So stay tuned. And if you've got any extra questions, please remember to put down in the comments below. We might just be able to help you. So let's get to know a few things about liposuction. What is it? Well, it's not just about looking good, looking skinny and, the nice body. And no, liposuction is a surgical procedure. They cut your skin, they cut through your skin. It's that serious. And so that's why it requires some time after you get back to your normal activities. Some people have actually described it as a mini vacation for your body, but without pina coladas, so to speak. Okay, let's get serious. So liposuction, as the term goes, liposuction. So they suck something out of your body, which is fat, of course. They call it lipoplasty or lipectomy. Lipectomy, any ectomy in anatomy, remember, is removal of something. So in this case, they remove your fat. Some people call it lipo, short term. So it's a type of cosmetic surgery that breaks up, it sucks that fat from your body. Often they use it for your abdomen, your thighs. You can do it for your arms, wherever you feel you've got too much fat that you want to get rid of. So the fat is removed through a hollow instrument known as a cannula. They insert under your skin. And then after that, high pressure vacuum is applied to the cannula. It's a very common cosmetic operation in the United States. In fact, they say that 300,000 procedures are carried out in the United States each year. But trust me, it's not for free. Expect to pop out at least 2,000 to about 3,500 per procedure. So if you're thinking of doing a lipo or tummy tuck, you better get prepared. But there's a difference between the two. That's between liposuction and a tummy tuck. They say liposuction is less expensive than a tummy tuck. According to the American Society of Plastic Surgeons, the average cost of liposuction is around about $3,548, while the average of a tummy tuck, listen to this, $6,092. And as if that's not enough, friends, those are not the only costs. There are other costs. That money only covers your surgery. There are other extra costs. These additional costs include your anesthesia, your facility to book the place where they're going to do your surgery, medical tests, compression garments that you wear after surgery, medications, and you also have to pay the surgeon who's gonna do the procedure. So now here's the information that you might need if you're preparing for your next lipo or your tummy tuck. During liposuction, this is what happens. The doctor or your surgeon uses specialized tools to remove excess fat from the targeted areas. Yes, you guessed right. It's like sculpting a masterpiece, but instead of using clay, they are reshaping your body. The good news though is that liposuction is not as invasive as your tummy tuck or your breast lift. And so that's why they say the recovery time is much shorter with liposuction as compared to tummy tuck. That means that you might be back in the saddle without the saddlebags before you know it. So during your liposuction procedure, they start by injecting a tumescent under your skin in the area that you want contoured. What's the reason for that? That's to limit bleeding and to prepare your fatty tissue. For each area that you want liposuction, they make a small incision in a place where the scar won't be conspicuous. And then they use ultrasonic energy to liquefy and break up the fat prior to removing it through the tube we spoke about earlier, called a cannula. And it's done. But before you go home, they give you detailed instructions on caring for your incisions. That's very, very important to make you comfortable and to also speed up the healing process. Now, here's a few things you might expect. Expect some bruising, just like any other surgery. Expect some discomfort in a treated area. You are going to have some pain. You may be sore enough for at least a few days, and so you might depend on some pain medications after surgery. And it may take a few weeks for your swelling to go down so you can see that nice little sleek body that you're looking for. Okay, let's go back now to the million-dollar questions that Mac asked. How long do you have to wait before getting freaky again? Back with your husband. Well, they say it depends on how much fat was removed and where was it removed from. For example, if they just did a little touch-up under your chin, you may be ready for romance in no time, in a couple of days. Some people maybe hours, depends. But then if they did a major overhaul, maybe on your thighs, your booty, the stomach, you might need to hit the pause button just a little bit longer. Why do we say that? Remember, your thighs, your booty, your stomach, they're so close to your vagina. And so there's so much exertion that goes on, especially during sex. Do you agree with me? You probably do agree with me. A little bit of patience will be needed. Yes, patience is the key. Rushing back to the bedroom too soon could actually lead to complications that Mac is talking about in the video. And trust me, nobody wants to go through a rupture of your surgery. So take it slow, follow your guidance, and before you know it, you'll be back in action, feeling better and better than ever. Okay, so you might now want to know the difference between the tummy tuck and liposuction. Both have similar goals. You want to slim down your tummy, you want to slim down whatever part of the body that you don't want. So with liposuction, they use a cannula and a vacuum-like device to suck out the unwanted fat that won't respond to diet and exercises from various parts of your body. However, with a tummy tuck, or what they call abdominoplasty, the aim there is to remove your excess fat, your skin, and tissues from the stomach. In addition to that, they tighten your abdominal muscles. Depending on the area of the stomach that you want toned and trimmed, you can actually opt for a mini, you can go for a full, you can go for an upper, or you can go for a reverse tummy tuck. This procedure is typically completed after a major weight loss, or usually after pregnancy. Simply put, liposuction removes excess and unwanted fat, while the tummy tuck tones and eliminates that sagging skin that you don't want after pregnancy. Different types of tummy tucks create different incision sites, but each tummy tuck method will create a certain level of swelling and tenderness around your abdomen, just like in liposuction, especially in the first week of surgery. They both have side effects such as swelling and soreness. That is normal at first. But then over time, those effects will gradually dissipate. But it's important to take great care of your body in the initial stages of of your recovery. But then we have to emphasize this in both cases, whether it's liposuction, whether it's tummy tuck, you have to wait before you get back to your sexual life. But then there's no hard and fast rules when it comes to that. Remember, every person has different rate of recovery. It's just like with every other operation that you may go through in hospital. Some people recover in a short time, some people recover in a longer time. So just how soon you return to your sexual life depends on so many things: your natural capacity for healing, the extent of your tummy tuck surgery or your liposuction. Age sometimes plays a role. The extent of your procedure as well. Like a full tummy tuck, the downtown may be longer. They say between about 4 to at least 6 weeks. It can even be longer than that. Remember, in your tummy tuck, your abdominal muscles are cut, so obviously they weaken down. And so you have to restart your recovery process, strengthen your muscles, wait for them to heal, and so forth. So it's a whole longer rehabilitation process. So many other factors come into play. Sometimes it's your general health. There's specific techniques that were used during the procedure. Your body's natural healing ability, remember, it's not the same. That also determines your recovery timeline. Noteworthy also is that in the first few weeks after doing your tummy tuck, your surgeon may insert a drain. Because remember, there's muscles and tissues that are cut. So sometimes there'll be fluids of blood on the incision area. So the surgeon may decide to leave a drain to remove all the fluids, all the excess fluids around the surgical area. Other things that are prescribed is a compression garments to reduce your swelling and to help support that healing tissues. Patients also experience limited mobility during the first few weeks. And so your doctor might prioritize rest for optimal healing. So you might not be able to move for a couple of days. But then getting to your second week, third week, patients normally notice decreased swelling and pain. However, it's very crucial to maintain a gentle approach to physical activity, and that includes sex. Your surgeon will actually advise you to avoid strenuous activities such as your heavy lifting during the second or third week. And then getting into your third week, fourth week, you may be able to start walking and engage in light exercises, as movement actually reduces the risk of your blood clots and they help to promote circulation. So all in all, what are we saying? Engaging in sexual intercourse too soon after your liposuction or your tummy tuck can, or rather we can say it may, pose several risks. So you need to be careful, especially if muscles of your abdomen, muscles of your thighs, your butts are the ones that are involved. Remember, usually when you're having sex, you don't just involve the pelvic floor muscles only. No, your thighs work, your tummy works, and so it's very easy to rupture your surgical site. And so that's the connection. Your vagina muscles may be the one exclusively used during sex, but then there are other external muscles that come into play. So you definitely have to be watchful of the risk of incision disruption because of physical exertion that can strain the sutures and the incisions. And that may eventually lead to reopening or even infection. So avoid vigorous activity that can exacerbate swelling and bruising, because that can actually lead to prolonged recovery. Consult your surgeon before resuming sexual activity. They'll be able to help you to assess your healing progress and provide that personalized advice based on your recovery. Even when you get back to sexual activity, start slow, start gently, then ease into intimacy. Shape that intimacy gradually. Begin with gentle, non-strenuous activities, of course, and styles that do not exert so much pressure on your abdomen. Remember, it's not just about intercourse. Familiarity can include a range of activities that are less physical and less demanding. Be mindful of your body. Pay close attention to your body signal. If your body says no, it's painful, don't do it. If a particular movement or position causes discomfort or strain, stop it immediately. Be open to your partner. Be honest with them. Talk to them about your limitations. Tell them how you're feeling. You need to understand what you can and what you cannot do post-surgery. That open line of communication ensures mutual understanding and a supportive environment. That's all for today, guys. Thanks for tuning in to our informative journey through liposuction. We hope this information will be very helpful for you, or maybe for your friend who wants to have a liposuction or that. Subscribe, and don't forget that notification bell for more content.